Today, I want to talk to you about the SARS Covid-2 with special emphasis for Gilroy in Santa Clara County. I'm going to emphasize prevention and treatment. And I wish you all stay safe and healthy. I am affected by this epidemic as well. Look at how long my hair has been. I have not had a haircut at the barber shop for 5 months. My dear wife cut my hair twice during that period. The SARS Covid-2 virus had special characteristics. It is highly infectious with rho greater than 2.2. Lot of asymptomatic and early spread. Symptoms are insidious, consists of cough, fever, fatigue, etc. This virus is very heat sensitive. I want to give you a perspective on this virus in the world. In this world map, the size of the circle is proportional to the number of cases. The virus first in December of 2019 started in China and has about over 30,000 confirmed cases. It then spread it to Europe, and from Europe to America, and then from America to Australia, many parts of the world. Today, North America, South America, Brazil, Russia, and India are the epicenter of this virus. I want to give you a perspective on the United States with emphasis on New York and California. The virus started at around the same point in both New York and California in around February. But by the time in March, the cases in New York shoots up because New York was not social distancing. Whereas in California, very early measure had taken place to social distancing. Therefore, we see an early spike in New York with cases, and in California, the cases simmer on. California is much better, much bigger state than New York. Therefore, by the time in July, the total cases in California exceeded New York. Because New York is not social distancing, by late March, mortality in New York has zoomed up greatly. And there are many more deaths in New York than California, even as of now. The power of social distancing, flattening the mortality curve, is now well proven. Now I want to focus on Santa Clara County, California. The first confirmed death is from autopsy study on a lady who ruptured her heart on February 7, 2020. She was ill from mid-January, but she never went to see the doctor or the hospital. She had a travel history to Europe as a business manager. She had never traveled to China. By March, we now know there were widespread of the virus in the community. and therefore the social distancing order was announced in mid-March. In March, April, May, at the hospital, I saw a lot of elderly patients who was in respiratory failure, and they had a very protracted illness, and eventually many of them died. However, between June, July, and now August, we have increasing number of cases, but our mortality is trending down. And the patients are a lot younger this day than before. So the COVID prevention strategy should consist of wearing a face mask, hand washing, eyeglasses, and social distancing. The face mask should cover both the nose and the mouth. The hand washing should be 20 seconds with using soap. And also use the eyeglass is very important to prevent the virus contacting our eyes. Additional step that I take, including a hot air hair dryer strategy, taking vitamin D, vitamin C, and also zinc. In this hot air hair blower strategy, I'm right-handed. I use my left hand to modulate the flow, and I wet my nose first. In the coming winter, the preventive strategy should consist of getting a flu shot, getting a finger oximetry to monitor oxygen, and adopt a early COVID testing strategy, and also pay attention to vaccine development. Three C's to avoid contracting COVID. Very close spaces, such as inside a restaurant. Very crowded space, such as going to parties, going to protests, and also close contact situation where a family member is not well. It is still possible to avoid COVID even in a close contact situation. You have to use strict face mask and also quarantine the person who is not well. Who are the high-risk subgroup? These are people who are elderly with obesity, diabetes, hypertension, cancer, or chronic disease. Unfortunately, in this high-risk subgroup, sometimes their mode of death is very prolonged with multi-organ failure. They could be on a ventilator for 20, 30 days, and when all the organs fail and the lung fail, there was absolutely nothing we could do to help them. I want to shift gear to talk about treating mild disease. First of all, it's important, even prior to getting sick, to prime your immunity by eating well with a lot of fruits and vegetables. Get yourself hydrated, and then practice all the prevention strategy. In case you did get in touch with the virus and you were sick, it's important to reduce the viral load early. That's why I use the hair blower strategy, and one can also consider nasal lavage. Doing breathing exercise and also sleeping on your stomach, which improve ventilation, can also help. And if you have an oximeter that monitors your oxygen saturation, keep it above 93%. And if you could walk 200 feet every day, you are going to be a survivor. For moderate disease, that means you have a pneumonia and your oxygen may be approaching the dangerous zone. In that case, you require hospitalization. We will use high flow oxygen and try to avoid intubation, that is putting a tube in your throat. Steroid and dexamethasone has proven to improve mortality. And the strategy of sleeping on your stomach also helps. For severe COVID disease, of course the patient needs to be hospitalized. And we also would consider using steroid or dexamethasone very early. Convalescent serum from a patient who had recovered from the virus is also very helpful. I have seen a case where the patient was at death stepped at our hospital with very low oxygen saturation 70%, 12 days into the illness. And when he received convalescent serum, 6 days later, he was extubated and he made a good recovery. When I visited him, he always pointed to heaven and said that his life was saved. Other treatment also included remdesivir. However, that drug is only marginally effective. Other regimens, such as antibody treatment, is being developed at this time. Also, patients at times had no choice but require mechanical ventilation. Stay safe, stay healthy, and practice your prevention strategy. Thank you.